Iwermektyna to lek o szerokim spektrum działania przeciwpasożytniczego, który wykazuje również właściwości przeciwzapalne. Iwermektyna jest pochodną iwermektyny, produktu metabolitu bakterii glebowych Streptomyces ivermicillis. Pobudza uwalnianie GABA, kwasu aminomasłowego, w wyniku czego dochodzi do paraliżu mięśni pasożyta, a w konsekwencji do jego śmierci. Poza tym iwermektyna wykazuje działanie przeciwzapalne za sprawą blokowania wydzielania cytokin. Iwermektyna jest stosowana w leczeniu trądziku różowatego, w przypadku strongyloidozy jelitowej, mikrofilaremii czy świerzbu. Ma zastosowanie także w innych przypadkach, np. w leczeniu wszawicy, zakażenia tęgoryjcem dwunastnicy, glistnicy, zakażenia włosogłówką ludzką, węgorzycy filariozy, ślepoty rzecznej. Środek ten znalazł zastosowanie także w weterynarii. Iwermektyna dostępna jest w postaci tabletek, maści do miejscowego stosowania na skórę oraz roztworu do iniekcji. Według doktora Briana Ardisa znaczna liczba zdiagnozowanych nowotworów ma w rzeczywistości charakter pasożytniczy, a nie nowotworowy, dlatego iwermektyna, lek przeciwpasożytniczy, jest tak skuteczna w ich leczeniu. Istnieją tanie alternatywy, aby zabić pasożyty i usunąć je z ludzkiego ciała, całkowicie naturalnie. Zamiast konieczności stosowania chemioterapii i radioterapii, aby spróbować zabić wszystkie komórki w ludzkim ciele, mając nadzieję, że nie zabijesz osoby. Dawkowanie iwermektyny według doktora Williama Makisa. Zalecana dzienna początkowa dawka to 1 mg na każde kilogram masy ciała lub 1 ml na 10 kg masy ciała. Dla osoby ważącej 50 kg oznacza to 50 mg dziennie lub 5 ml płynu, około 1 łyżeczka. Lek można stosować przez wiele miesięcy.
So we now come to the most important graph that I've put together in the past year, and it is the dosing schedule for ivermectin. I would suggest for most cancers, you want to be looking at 1 milligram per kilogram per day. That would be my starting dose for most cancers. And cancers that have been shown to work with ivermectin, there's many different kinds of cancers. You've got breast cancer, colon cancer, lung cancer, you've got pancreatic, renal cell carcinomas, gastric cancers. You know, there's many different cancers that you can try ivermectin with, leukemias, of course. The one cancer I have not seen almost any research on with ivermectin is lymphomas. I just have not seen any papers talking about lymphoma and ivermectin. That doesn't mean it doesn't work. It just means that, you know, there aren't any studies looking at lymphomas. This is the dose that I would start with. Dr. Shankara Chetty had that prostate cancer patient whose PSA dropped from 89 to 11. He used 45 milligrams of ivermectin per day. So when you think about the dosing, 1 milligram per kilogram, typical person is 60 kilograms. That means you're going to be using 60 milligrams of ivermectin per day. That's 5 pills of 12 milligrams each, or 6 ml of the liquid ivermectin, and 6 ml is basically 1 teaspoon. That is the way to think about it per day. 1 teaspoon per day, once a day. And there's been no report of long-term side effects with 1 milligram per kilogram. And there was that study by Castro looking at children who were taking 1 milligram per kilogram they had leukemia over the long term with no side effects. You can start lower. Dr. Tessalori reported a case with a much lower dose. This dose was actually 0.2 milligrams per kilogram. And there was still an improvement in ovarian cancer with the blood markers, the CA-125 levels dropping from 288 to 22 after 2 months. So there is anti-cancer effect. It is dose dependent. There's evidence that the anti-cancer effect of ivermectin is dose dependent. So higher dose, you may get better efficacy. Now, if you have extremely aggressive cancers like leukemia, pancreatic cancers are extremely aggressive, and brain cancers. Now, there is some question about, does the ivermectin cross the blood-brain barrier? It does. because you do get neurological side effects, but it doesn't cross it very well. So you may, for brain cancers, you actually may need a higher dose, like 2 milligrams a kilogram. And again, this is the case of Dr. Landrito's doctor colleague, who had that terminal gallbladder cancer. She took 2 milligrams a kilogram a day for 14 months, and her cancer disappeared. She had some visual side effects, but then those went away after a few days. Now, the highest dose that I've seen is 2.5 milligrams per kilogram. Mainstream oncologists will not even offer you ivermectin. So this is as far as some people have pushed the dosing, 2.5 milligrams per kilogram. Again, Dr. Shankara Chetty had a patient on up to 2.5 milligrams per kilogram per day without any long-term side effects. So at 2 milligrams per kilogram or 2.5 milligrams per kilogram, you might get some visual effects, but they don't seem to last long-term. They only seem to last a few days. I would suggest for most people to start at 1 milligram per kilogram, and then depending on your personal situation, adjust from there. You can always adjust upwards. So that pretty much covers it. Using ivermectin in cancer is honestly very straightforward. 1 milligram per kilogram per day is your typical starting dose. If you're using the pills for a 60 kilogram person, that's 60 milligrams a day. That's 12 milligram pills a day. If you're using the liquid version for whatever reason, that's 6 ml per day. That's a teaspoon is 5 ml, right? So that's basically a teaspoon a day of the liquid ivermectin. And that's it. It is a very, very safe drug. It is off patent. You can get generic versions of ivermectin. No one's going to make any money off it. And there are no clinical trials right now looking at ivermectin in cancer because there's no money in it. So I really strongly suggest, if you are struggling with cancer, look into ivermectin at a starting dose of 1 milligram per kilogram per day. You take it as long as there is evidence of active tumor. You can take it for months. In the Castro study, those children with leukemia were taking it for 6 months. There are anecdotal reports of people taking it over a year on a daily basis without any long-term toxicity or side effects.